Hi everyone, this is Dr. Hall. We're going to continue on with lecture 24. So far we've talked about the parasitic infections, and in terms of bacterial STIs we've talked about syphilis. And in this one we're going to talk about the other two bacterial STIs, chlamydia and gonorrhea. So I'm going to talk about chlamydia and gonorrhea together for most of this mini lecture because they share a lot of similarities. This is what they look like under the microscope. They're little teeny bacteria. Gonorrhea often comes in these kind of two little round bacteria that are kind of hooked together called diplococci. Chlamydia is usually just round. This is what they look like inside of cells. So what's interesting about these bacteria is they have to get inside of and live inside of a cell. So that's a cell, this is a cell, right? And then in this view, this is a much lower magnification. So this is a cell, and you can see these little red things inside. That's the gonorrhea. So the full name for chlamydia is Chlamydia trachomatis, and the full name for gonorrhea is Neisseria gonorrhea, just so you know that, but I'll just be calling them chlamydia and gonorrhea. They are intracellular bacteria. As I mentioned, they can only live inside of the cells, which is why these are not infections that we worry about getting infected from fomites, right? These are really pretty wimpy. They require pretty direct inoculation. So how do you get it then if it can't survive outside of cells? Well, you have to have really intimate contact with goopy bits. So you have to have contact of infected body fluids such as vaginal fluids, semen, mucus from inside the anus, that comes into contact with a mucous membrane. So your mouth or throat, your urethra, your vagina, your anus. So it's transmitted by sex. Both of these are transmitted by sex. So I do want to point out that one difference is that gonorrhea can infect the throat, so you can get gonorrhea by performing oral sex on someone. Chlamydia doesn't really infect the throat, so you can't really get it that way. Notice here that if you get infected body fluids on intact skin, you will not get infected, right? So it really has to be with those mucous membranes, those gooey bits that are easier for the bacteria to kind of absorb into. So the symptoms are almost identical for both chlamydia and gonorrhea with a few exceptions. So that's why I've got them kind of listed side by side here. So depending on where they go, right, if they go to the epididymis, you're going to have epididymitis. If they go into the urethra, you're going to have urethritis with that burning pain with urination and perhaps pus dripping out of the penis. They can infect the vagina and the cervix, causing a vaginitis or a cervicitis. And they can both get up from the vagina. Yeast and BV don't do this generally, but they can get up from the vagina through the cervix and into the uterus and fallopian tubes, and that's that more significant infection called pelvic inflammatory disease, or PID. So both of these can cause PID. You can see it right here and right here, and that is a deeper infection, so it's more serious, oftentimes requires IV antibiotics. They can both cause rectal infections called proctitis, and they can both even cause pink eye. So the membranes on your eyeball and on the inside of your eyelids, that's your conjunctiva, and they can get infected too. So I'm going to highlight some of the differences here. One is that gonorrhea, as I mentioned, can infect the throat and cause a pharyngitis. The other thing about gonorrhea is that it can actually cause what we call disseminated disease. Gonorrhea can travel through the bloodstream and infect your skin, infect joints, infect parts of your heart, so it can also become more widespread or disseminated. So that's a big difference. The other difference, I'm going to erase the arrows to PID because those are the same. The other difference between the two is that chlamydia is usually asymptomatic. All right, this is the killer. So 75% of female-bodied people have no symptoms when they have chlamydia, when they have a vaginitis or a cervicitis from chlamydia. They have no idea that they have it. And in 50% of male-bodied people, they don't have symptoms either. This is very clever of chlamydia, right? Because then you're going to keep having sex and you're not going to think, oh, I should go get tested, something is wrong. So this helps chlamydia to be able to spread among the population. Gonorrhea is different. So gonorrhea most of the time causes symptoms. So 90% of people who have an urethritis or vaginitis or cervicitis from gonorrhea, they have symptoms. In fact, one of the nicknames for gonorrhea is the drip because the discharge out of the penis can be quite significant. The difference here is if you have the proctitis. If it's a rectal infection, then actually most of those have no symptoms, but you can transmit it to a partner. So those are the big differences between the two. But they most commonly they cause urethritis and cervicitis. So that's an infection of the cervix that we're looking at there. But again, most of the time chlamydia, no symptoms. So how do we diagnose it? So we have several different ways to test for chlamydia and gonorrhea, and what we're actually testing for is the actual DNA of the bacterium itself with a PCR test. And we can do that from somebody's urine. And just so you know, if you're going in for a test for chlamydia or gonorrhea, we're often going to ask for a urine sample, but it's important that you don't urinate for an hour before collecting that sample because we need some of it to kind of build up in the urethra a little bit so that there's a good enough amount of the bacteria that they can be detected. We can also do a vaginal swab, like a Q-tip sample from the vagina or the rectum or the throat if we're looking for gonorrhea. We don't do throat swabs for chlamydia because it's not a location that chlamydia tends to infect. So a really nice thing about the tests for chlamydia and gonorrhea that's different from the test for syphilis is that they can detect infection within 2 to 7 days after exposure. So if you had a suspicious hookup a few days ago, you can go in today and get tested and be reasonably sure that if there's an infection, it's going to show up, which is pretty great. The one thing you have to keep in mind, however, is that because these bacteria can infect so many different locations, you have to test all of the areas that have potentially been exposed. So if you've had vaginal receptive intercourse, then definitely a vaginal test. If you've had anal receptive intercourse, you also need a rectal swab or an anal swab. If you've performed oral sex and you're concerned about gonorrhea, you have to do a throat swab because sometimes you can have the infection in one of those locations and not have it in the others. In fact, they did a study at an STD clinic in San Francisco. And so what we're looking at here, these little pie charts. On the left-hand side, they looked at cases of chlamydia that were diagnosed in their clinic. So of all the 574 cases that they diagnosed during the period of this study, 47% of them were identified because they had a urine test done. 53% of them had rectal chlamydia that would have been missed if they had only done a urine test. So if you engage in anal receptive intercourse, you need to let your provider know because they need to check all these different locations. For gonorrhea, it was even more significant, right? So they would have missed almost 2/3 of the cases if they hadn't also done rectal and throat swabs. So a urine test is not necessarily enough depending on what types of activities you have participated in. So the treatment is going to be antibiotics. Chlamydia, it's a single dose of antibiotics that then kind of stays in your bloodstream for a while, and it works really well. It's important, however, to not have sex for 7 days. You have to give the antibiotic time to work before potentially having sex with somebody again because you could pass it on. So no sex for 7 days. We're going to identify, test, and treat your partners, and we're going to recheck you again in 3 months because these things, again, you can get infected multiple times, and sometimes we see it where a partner gets diagnosed and we treat them, but they have sex before the 7 days are up. And so their partner is infected, or their partner was already infected, and they take their antibiotics, but then their partner gives it back to them before their partner ends up going in and getting tested. So it kind of bounces back and forth like a ping pong ball sometimes. So we always look for reinfection in 3 months just to make sure it stayed gone. Similar for gonorrhea, although gonorrhea, where, a long time ago, penicillin was all you needed. So here's another one of those ads from the World War II era, right? Buy bonds, right? So this is to support the war effort. And you can see they were putting it on mailboxes, right? This was a big public education effort. Penicillin cures gonorrhea in 4 hours. See your doctor today. Well, so penicillin doesn't work for gonorrhea anymore. Actually, gonorrhea has become resistant to lots of antibiotics. In some parts of the world, gonorrhea is resistant to all available antibiotics to at least some degree. We're pretty lucky for the most part in this country, but for that reason, gonorrhea has to be treated with 2 antibiotics. Usually one is a shot and the other is tablets that you take for a period of a week. Again, no sex for 7 days. We're going to identify, test, and treat partners and then recheck again in 3 months. So, chlamydia and gonorrhea will not generally kill you, unlike syphilis, which can. The worst thing that chlamydia and gonorrhea can do is pretty significant, however. It can cause pelvic inflammatory disease, right? That infection of the uterus, fallopian tubes, and or ovaries, which will cause fever and pelvic pain, and people can get very sick from this. Sometimes, as a result of PID, you can actually develop infertility. The infection can cause a lot of scarring inside the reproductive tract, particularly inside the fallopian tubes, which can interfere with that normal passage of the oocyte down through the fallopian tubes. And so we know that about 10 to 30% of female-bodied people with untreated gonorrhea or chlamydia will develop PID, right? So that's pretty serious. And of those people who get PID, 10 to 15% of those people will become infertile. So a history of untreated or severe chlamydia or gonorrhea infection is actually one of the leading causes of infertility. In male-bodied people, that urethritis that can develop and kind of simmer for a long time, potentially without symptoms in the case of chlamydia, can cause scarring on the inside of the urethra that leads to strictures or narrow spots, which then can make it difficult to urinate and cause some other symptoms. So there are some long-term and potentially serious consequences of chlamydia and gonorrhea. So even though it may not be causing you symptoms, we definitely want to identify it and treat it. So in summary, gonorrhea and chlamydia are bacterial infections. They require intimate contact, right? So direct contact of infected fluids with mucous membranes, so sex. They can infect any of those locations, right? Urethra, vagina, anus, rectum, or throat for gonorrhea only, not chlamydia. And remember, chlamydia has no symptoms more than half of the time. So it's very possible to have it and not know that you do. Gonorrhea, on the other hand, almost always has symptoms unless it is a rectal infection. Tests are highly accurate and turn positive within a week after infection, but we need to be sure to test all potential locations of infection. So if you do have anal receptive intercourse, we need to check a rectal swab as well. Treatment is antibiotics, and we need to make sure to treat them because they can go on to cause PID and potential infertility, or in male-bodied people, urethral strictures. So we're going to pick up with the next lecture. We're going to talk a little bit more about the epidemiology of gonorrhea and chlamydia because it's kind of interesting.